Syntax 2 is basically a strategy to use pressure wire, this physiology-guided treatment, complete the treatment by IVUS, use a Syntax score 2, which does not limit the interventional cardiologists to the class 22, class 33 in the Syntax score anatomic. And with this new stent, which was the Synergy, have that strategy to improve the result. Because don't forget that in the guideline, we are limit for the three-vessel disease to 22. So we have to reopen that cage in terms of indication for three-vessel disease. That was the goal. What was really amazing in this trial is that we reduced with respect to the Syntax 1 because it was, the comparator was the Syntax 1 PCI and the Syntax 1 surgery. So we have two comparators. And in terms of angioplasty and PCI, the results were really superior to the Syntax 1 because it was the Taxus. So there is no doubt about that. But it's interesting that this better result in terms of outcome was obtained because the IVUS was used in more than 75% of the case, because basically all the lesions were interrogated from the physiological point of view, and we could reduce considerably the number of lesions to be treated. Instead of 4.2, it became 2.39, 2.4. That's a major advantage. Instead of 87% of three-vessel treatment, we will reduce to 32%. So considerable simplification of the treatment without a bill to pay, without a price to pay. Because what is fascinating is that between the second year, the first year and the second year, there is only 20 lesions who had to be retreated, out 1,500. And among these 20 lesions, 71% were restenosis, and there was only 3 deferred lesions who had to be treated. So that's the big news. And on top of that, the stability over the second year, which was quite remarkable. And finally, 2 additional points is that usually the three-vessel treatment PCI cost the outcome of surgery around the first and the second years, and we are just in parallel. So we keep with the surgeon. Of course, the surgeon will say, we have to wait 5 years, we have to wait 10 years. But today, I think it's really difficult to do this big trial like Cabri, Syntax, Excel. It's really a major investment. I think that this meeting was important because the first day at this meeting we had this unbelievable data on the patient-level meta-analysis of physiologically guided angioplasty with a reduction in myocardial infarction, and in the SCAR study, a reduction in mortality. That's really phenomenal because a lot of interventional cardiologists came out of the room with some sense of optimism because we have been criticized. So really the community start to think that you have to work what needs to be done physiologically. That's the big message of this meeting, and the Syntax 2 goes exactly in that sense, but in the most complicated population, the three-vessel disease. You know, I've been working with the surgeon. They are my friends for a long, long time. Sir McD was the first to help me to do trial in UK. I think that their first reaction will be, it's not randomized. It is a matching by propensity and using the Syntax score 2. It's too short outcome. And, you know, they really ask for 5-10 years. And that's the classical question. Recently in the Lancet, they made a 5 years follow-up of all these trials we were okay with the main stem, but in the three-vessel disease, there were more mortality, especially in the difficult patients. So we have to keep working on refining our technique and being specific with the ischemic lesion. I think that the first thing is that we're going to keep this patient, follow this patient very carefully, because if the message gets reinforced at 3, 4, 5 years, I think the grant giver and the ACRI can be promoting a long-term follow-up, and that's always important, the long-term follow-up. Is that going to stimulate somebody to make another trial versus surgery? I guess. But by experience, I've done that 5 times in my life. It's hard work, it's raising a lot of money, it's a lot of bargaining with the surgeon. And these days, with the valve, they're getting a little bit nervous.